The views expressed on the Jerry Cahill CF podcast are that of Jerry Cahill and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing on the Jerry Cahill CF podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Jerry Cahill CF podcast presented by the Boomer Esiason Foundation and jerrycahill.com.
When I was little, I led a totally normal life. I played soccer and I played the flute and I went to school and I got in trouble and I did all the normal childhood things. And I feel really grateful that I was able to form an identity that wasn't completely defined by CF. I went to college and I went through a rough bout. And it was after college I was diagnosed with CF-related diabetes. I permanently lost a big chunk of lung function, and so I'm 33, I have about 35% lung function, and stability is the name of the game for me. There are 6 different categories of CF mutations. Nonsense mutations fall into the first group. It's like a stop sign in the production of the CFTR protein. So instead of producing the full-length protein, there's a stop sign that halts production, and it produces a truncated or a shortened version of the protein. These CFTR modulators that are coming are for anyone that has just one copy of delta F508. But for people like me who have 2 copies of a nonsense mutation, none of them will benefit us. Back in 2011, we were seeing all these really exciting things happening in CF research and treatments, and there was this new hope and excitement in the field that I think everyone in the CF community was feeling. And so it was incredibly exciting, but it became clear that they were targeted at specific mutations. And I have 2 copies of a nonsense mutation, and unfortunately wasn't going to benefit from any of the breakthrough drugs that were coming. And so that became evident to us. And at the same time, my own disease was progressing. And I was kind of crossing conventional treatment options, off. It was incredibly scary. There wasn't a lot of hope to grasp onto. And I'm a pretty optimistic person, and there was nothing coming in the research pipeline that was going to save the day for people like me. We kind of realized it was up to us to try to do something. And so despite the fact that we had no background in fundraising and no background in science and really had no idea what we were doing, we were crystal clear about what we wanted to happen. The work that we are doing is to try to extend the breathtaking progress to the final 10%, accelerating research and drug development for nonsense mutations of cystic fibrosis. There are game-changing breakthroughs that are in market or in development for roughly 90% of the CF population. And at Emily's Entourage, we firmly believe that everyone with CF deserves real, tangible hope for, a deep breath and a long, healthy future. We have so far raised about $3.7 million since 2011, and we have awarded $3.4 million of those dollars to research. To hear that we're able to provide hope and that they know that there's a group that is fighting for them, to me that is those are the tearjerker moments. I don't think there is any community that is more capable of moving mountains and achieving the seemingly insurmountable. Although we are, relatively rare among the CF community, About 12% of all genetic diseases are caused by nonsense mutations, which means that there are about 30 million people worldwide who are living with a genetic disease caused by a nonsense mutation. So although we're relatively rare among CF, we're plugged into this much larger community. And what's exciting about that is the advances that we're pushing for in drug development, drug discovery, have the potential to help far more than just the CF community. And that's critical for making a business case to drug developers. People don't realize the kind of change and ripples they can make in the world, and they don't realize how powerful their story can be. It's not until you put your needs out to the universe that people can really step up and help out. Life with CF is really hard, and you have to really want to live to fight through CF. And the work of Emily's Entourage is really important for providing purpose in my life and for making it bigger than just about surviving each day. That's my proudest moment, to see the CF community believe in the work that we are helping to advance.